Here's an unscientific view of patients that we meet in the pain clinic and things you need to watch out for.
This is an analogy of a wrestler as a cell and axon and how it affects pain. Wrestlers give pain, they experience pain, and at times they enjoy pain. This is about our patients and when they come to see us and how pain affects them and how it affects our care. The wrestler wasn't the same his whole life. He was affected by disease, chicken pox, family members who loved him, all the things that happened to him early in life. Erickson and Freud would say, nurture, nature, they'd argue, but there's no doubt that everyone believes that they were absolutely influenced by life. Throughout your patient's life, good and bad things happen to them, hopefully more good than bad. But a lot of times it isn't that way. Some of them enjoyed life. Their cells were bathed in good things. They had rest and food, and they enjoyed life. Some didn't. Some just perched and watched and learned. You may meet some adults that mention being trained by the Skittle technique, where they're thrown by their parents in the air and bounced on the bed when they can add a letter to the alphabet that they didn't know. And when they land and bounce, they get a Skittle. If you ever get a patient like this, he's probably going to be a very happy patient and well-rounded. Some patients have been subjected to brutal king of the bed games that have broken many beds. They've caused kids to just fight, just to be champion. They just want to win. They just want to be the king of the bed. And they need to learn that happy wives make happy lives, and often they haven't learned that lesson yet. Our genetic makeup always makes us seem to do certain things in life. I think it helps us survive. Some are luckier than others in things that they do. But we have certain traits that we do that just seem to keep us comfortable and make it through life. Some of it's sitting. Hopefully as your patients grew, they didn't have anxiety in their life. Hopefully they grew up happy and loved to experiment and do things in their young childhood. H.G. Granger, D.O., says, anxious man in real life brings to each new challenge old ones unresolved. Hopefully your patients don't have too many of these. Hopefully when your patients get to you, they grew up strong. They were able to have a good balance, good cells, good life, good food. They were able to get to a point where they're strong. Hopefully psychologically they are too, because both of them can affect their pain. Hopefully you're able to just treat pain from a physical standpoint. Hopefully your patients didn't receive pain in any bad ways, psychological or physical. In wrestling, you learn that there's appropriate ways to give pain and that pain is always an art of your craft. If you learn to control it and use it and give it, it makes you very strong. Patients affected by great nurturing seem to handle things much better. In these people, you'll see they're ready to come in and have their pain treated. This doesn't happen often, it seems, because pain seems to affect your mental outlook on life. But it's a good start to have good nurturing early in life. Working with your patients, you'll see that it's always important as you talk to them to see what affected them when they were young. Even when they're old, you will look back and the things that happened to them when they were young have affected them then and now. We need to always be cognizant of that and give them kindness and care. As patients age, many things affect them and they fear many things. I've seen patients who fear pain. I've seen patients who fear losing their job, their wife, who just fear having to go into the hospital. The sad part is, I've seen patients who fear success. Very important to look at patients' friends if they come with them. Are they friends who help them work with the condition that they have, or do they work against it? You may want to have them in the office or not. When someone has a good friend to lean on that keeps them looking at good things in life and realistic things, it's great. All of us live in a bit of a sandcastle. We feel that we're protected and safe. We think life will go by. We don't fear much. But when you start to have pain, it changes how you think about things. You wonder how things are going to be. That castle you lived in, you find out is made of sand and it crumbles. It's good for someone to have a support system in their life. It's important to check this out. It might be a brother, might be a wife, might be a son or a daughter, but they need someone they can depend on to help them through the bad things that are going in life. A lot of times when they're young, it's a brother or a sister. When you have a friend, sometimes things go easier in life. You can depend on them, you can move around, you can talk about pain, you can have problems, but you can always lean on each other. It makes life much easier. When patients are in pain, we need to always remember where they came from. They were little once, and when you're little and you're growing up, you're always about to fall, and things could always get a little cold. So remember, even if patients are doing well, it's important that we help them to get through the hard times. No matter how big and strong a patient is, no matter what their job is, how powerful, it won't really matter. When they come to see you, they're in a very precarious and nervous position, and they hurt. Remember, there's a little kid in there that's reaching out for help. It just needs someone to hold them and make them better. So much of caring for a patient I've found is being able to work with their spiritual influence, the culture they grew up in, how they cope, how they're struggling with life. It's funny how you'll be in parts of your life and, it just depends on the way things fall, how you end up and feel. As that humbled mass of cells comes limping in, your patient, be sure to remember that there's a lot of things going on inside of them. There's a depth and breadth of things that we will never know. It's too complex, but we can look at them inside and try to figure out and help them feel like a champion again.